Okay, so there we are. So that's a vessel there, and it's obviously quite overpowered. So what we do is we take the scale up now.
So you're on the what CFM setting there?
I'm on the colour flow, yeah. So if I take the scale up, okay, so you can see that is getting rid of the noise now. So I'm using the bigger scale, and the scale is up the top here. Yeah, centimeters per second. Okay, so if you get a lot of noise, if I take the scale down, yeah, that's wanting to read slow flow. Okay, 5 centimeters per second. So if you've got fast flow there, it's going to do what we call aliasing. So it's going to go everywhere. So the slightest movement is just going to give you an overpowered colour flow sensitivity because it's looking for low flow and it's obviously quite a fast flow. So you take the scale up to say I want to look for faster flow, and then it meets the requirement. So now I'm up too high, 42 centimeters a second, and it's not reading it because it's too high. So this is what I mean by say it's crucial to get your settings right. So come down the scale, and then you'll start to pick up the flow again nicely. And don't forget, when you're using the colour doppler, it's red towards the probe, blue away. So just so you see that red there, that's going towards the probe. If I angle the probe the other way, I get more blue because it's going away from the probe now. It's not the blood direction is not changing, obviously. It's just by probe. Okay, so now it's going away from the probe. Angle it the other way. Now it's going towards the probe, so it changes colour red. Okay, so it's mainly the scale you want to do.
So you're always going to use CFM just to look at blood flow?
Yes, you can do if you want to know what direction it's going. So this colour flow is for direction. If you're not bothered about direction, then obviously PDI, which is the power doppler, will just give you flow. So that's independent of direction. Okay, so it's orange no matter where you angle. Okay, so that's probably a little bit overpowered, so we can probably take the scale up a bit. It'll just crisp that off a little bit.
So if you're not looking at a blood vessel, so for example, you're looking for a tendinopathy, are you best to use CFM or are you best to use PDI?
So PDI for sure. Yeah, it's a lot more sensitive.
I think that's one of the common misconceptions there between CFM and PDI. So that's great to have that clarified for you guys. And of course, just shrink that box to just about as slightly bigger than whatever it is that you're looking at. Otherwise, if it's too wide, you're just losing signal. Yeah. We're just not getting it. So you really got to adjust your little box setting to make sure.
So when you're setting it up, obviously we're in the elbow here, but you want to go to find a vessel or something that's close to what you're looking at. So if you're looking in the foot, find a vessel in the foot, and then adjust it so you get a perfect vessel image, not too overpowered, not underpowered. Change your frequency, change your scale frequency to get the perfect image, and then you can alter the gain as well. Turn the gain up just in case that's been turned down. And you can sort of overgain it so you get a lot of speckle, and then turn it back until just the speckle goes. And then you should be optimally set up then, and then you can look at the area that you're interrogating properly.
So just so you can see the colour flow. This is your neurovascular bundle, so on the medial ankle here. Just to show you some an easy vessel to get to. And there's Adrian saying if I angle away from the probe, that's to blue. And if I go up towards the head, it's showing the red. And also it's nice to be able to help to differentiate sometimes between a nerve and a tendon and a blood vessel if you've not quite got your imaging right. So there's another good way of just differentiating between the different vessels, because without that there, and with too much, it looks much the same, doesn't it? The only giveaway really is you can see the artery pulsing there. But otherwise, if you're just looking at that in that axis, it's going to be a bit difficult to say where you are. So using your colour flow to localise your anatomy. And also, if you want to do blocks, you're looking to do a ankle block or something like that, so you can see the nerve there, you can see where the artery is and where you don't want to go into. You can pretty much just.
Yeah, well remembered, Steve. BARS. That's the acronym or whatever you call it to
I'm impressed.
Yeah,
you are the quite expert.
like a sponge, Steve. A sponge.
Whenever you simplify it, very simple, then I'm on board.
Yeah, so BAR, B-A-R-T, blue away, red towards. But just remember that if you're using someone else's machine and they do vascular or whatever, they can sometimes flip the colour around. So you just need to make sure, if you look on the screen, if you look on the screen here, just make sure that this is set to red at the top, blue at the bottom, because if it's not, if it's set to blue at the top and red at the bottom, then the acronym's the other way around. Okay, so you must make sure that the red is on top for that BART to work. I don't know why they make machines where you can swap them, but they do.
But why would an individual practitioner choose to? Or it's how the manufacturer set them up. It's not the users.
Well, yeah, no, I think it's to if someone's scanning from the head end, or they just like to look at it in a different way. Because obviously when you're at the head end and the carotid arteries obviously go up towards the head, they like to look at things maybe the other way around, just to make more sense to them. So they can change it around. But conventionally, when you're working like this, it's always usually that.
This is your dorsalis pedis artery pulsing away, so I've just moved slightly anterior onto the dorsal of the foot. I suppose you could look at even in the diabetic patients and things like that, you could look at the artery and look at the walls of the artery and how big or how small it is, how much blood flow, is there any calcification, some calcium deposits in there, arteriosclerosis kind of things you think you can see?
Yeah, absolutely.
Yeah, so it's really valuable for vascular investigations as well as